Now we've got Jordan from Vancouver who asks a very loaded question. Why hasn't BC signed on to the federal COVID-19 app? It's a question I've been asking as well. So I'm waiting for the answer, which you may not be able to give because
I may not have it. I can tell you that we would love for BC to sign on. And I know that, listen, Dr. Henry is a very trusted public health official, as she should be. And I think she's doing amazing things for British Columbia. But I think the more of us that sign on to this app, obviously the stronger the tool becomes. It's really important for a couple of reasons. I mean, I'm speaking about individuals right now. I mean, some people are really stigmatized by getting COVID-19, and it's a hard conversation with a public health officer to say, oh, I have a special friend and my wife doesn't know about that special friend, for example. Or, oh, I went to a party and I saw 3 people, but I told them that I'd had a negative test, but I didn't really. Like, these are the kinds of things that people are struggling with.
Reality,
The reality, right? And sometimes it's just people can't remember. They've been so active, they don't remember the long list of people that they may have spent time with. So COVID Alert actually helps out in those circumstances, and it provides complete anonymity to both the user and the person who's been diagnosed. So
I think that's important. The anonymity, the privacy, that you just know that you have been in contact. You don't know with whom. Nobody says anything. So you just say, okay, you've been in contact, go on. And I think one of the problems is that we well know that if you're going to phone people to do contact tracing, most people won't answer the phones. Most people don't know who's calling them. Most people won't pay attention to a letter in the mail. But if you carry your cell phone with you all the time and it goes ding and it says you may have been in contact with somebody with COVID-19, get a test.
That's it.
That's then, that's there, it's easy to do.
It's empowering actually for people. And so we updated the app last week so that it actually alerts users, even if they were in contact with someone who was developing symptoms, because we know that you can be contagious even before you have symptoms.
Yeah.
But I'll tell your listeners this, even though the province hasn't signed on, there's nothing stopping them from downloading the app because they can. And if they have contacts from other provinces, I know lots of people, for example, have family or relatives in BC or other parts of the province, Alberta, other parts of the country, that it will actually still work. So if, for example, you have COVID Alert on your app, Hedy, and you come to Ontario and an Ontario member of parliament tests positive, you still would get an alert, even though you're in BC, that you've come into close contact. So I would say, even if the province has not signed on yet, and we sure hope they will, that you download the app anyway, because especially if you have any contact with people that are leaving the province, because it gives you another sense of security and another layer of protection.
But every province is signed on with the exception of BC and Alberta. Is that it?
Yeah, I think there might be some of the northern provinces too. I can't recall. But yeah, pretty much it's BC and Alberta that's left. And listen, I mean, Alberta could really use it right now. And the other challenge is, don't forget that as systems get increasingly strained with growing numbers of people sick with COVID-19, the contact tracing falls apart. You just can't continue as a public health agency when you're getting more and more and more cases. It gets harder and harder. And eventually public health agencies give up. And you've heard that, high profile places saying we no longer, Toronto, for example, no longer contact tracing at one particular point. That's because they just can't. But the COVID Alert app continues to do its work, and it does its work efficiently. So it's an actual opportunity for BC to, especially as cases are climbing all across the country, to really have that additional digital tool to give a break to the public health nurses that are just trying to keep up.
Yeah, well, that's good. Thanks very much.